Hi, everybody. Ooh, that's loud. So welcome to the breakout session that is for tribal leaders and tribal child welfare directors and people here on their behalf to meet with Commissioner Milner. And so I'm not sure exactly how people want to proceed. I think this is just to be a conversation. And I don't know if Commissioner Milner wants to say anything to start with? No? So we can just start off with questions, comments, discussion. We've had a lot of information today, some of it very technical. I just came from in this room was a presentation about cultural adaptation and by Holly Echohawk that was very helpful, very, I could follow it. It was very simple and so I knew what she was talking about the whole time. So that was very helpful. So I guess I would just maybe kick off with questions about culture adaptation. I know that language is used in the legislation, and so I guess just broadly, how is that going to work? Do you know?
Well, no, we don't know. We're going to have to figure that out, and our intent is to use our consultation with the tribes to get the kind of input that we need to make those decisions. That, along with the performance measures that are also required that we develop for the tribal programs under Family First. We want to get the input before we actually make those decisions. So this may be an opportunity here today to start that and give us your thinking about what that might look like. And again, through the summer where we do a more focused consultation, we'll also use that opportunity to get to those areas. But I'd love to hear your thoughts about that and guidance on how we might proceed that in a way that would best meet your needs and the needs of your families. Yes, ma'am. Mm-hmm. Oh, go.
We've been using positive Indian parents under one of our federal funded programs for 5 years before, and now we're in the second year of a second 5-year round. It isn't one of your approved plans, but it must have been good enough to get funded federally for the last 7 years. That isn't, I don't know where that would fit in the promising or the supported or the, yeah. Another one we use is Sacred Fatherhood and Sacred Motherhood. We use that as well, and it doesn't hit your promising or well supported. So we will be looking for ways, I guess, to try to get them into that category. And I'm not sure how to do that. Yeah.
The law is quite specific about the criteria for supported and well-supported and for promising. But we have a lot more latitude at the promising level than we do at the two higher levels. And what we would like to have happen is to be able to screen in programs rather than screen out programs at the promising level so that states and tribes can continue to use those programs, those services that are working well for them while we're building the evidence to get them to a higher level. Now, I can't say for any specific program that we're going to be able to screen it in at the promising level. But I would say across the board in a general way, that will be our approach, is to try to screen those programs in if they meet the minimal criteria that are there for promising.
Want to talk loud, or do you want the mic?
It's up to you.
There you go.
I can talk loud. I guess I'm from New Mexico, and we're representing not only the Pueblo of Zia, but other pueblos in New Mexico and tribes in New Mexico as a consortium. I think and Texas, I'm sorry, and El Paso, Isleta del Sur, they're part of our consortium. Thank you. I'm sorry, Leah. Okay. I think one of the concerns I have, and one of what we would hope, is that we're allowed the flexibility to be able to use promising practices, especially in the rural areas where we don't have access to resources, from cities or from places that have programs. And it's going to be really hard for tribes in New Mexico and pueblos in New Mexico to be able to access those because they're very isolated. So the concern I have, and also the consideration I want you to take, is that I don't want to see this legislation put poorer tribes, like Zia is pretty poor, we don't have a casino, and marginalize them and not allow them that access because we don't have the infrastructure and we don't have the expertise to do all the things that is required of this. So that just needs to be given some thought, in my opinion, especially in New Mexico. And I know Zia is not the only pueblo or tribe that is in that situation.
Hello again. I just want to echo what the gentleman from Zia said, because our tribe is very, very small and we're isolated. We're surrounded by the Navajo Nation. And our nearest town is 65, 70 miles away. Our biggest town, Flagstaff, is about 100 miles from where we are. So one of the things that I want you to consider is what really is expert and what is evidence-based. Because our tribe has for centuries had their own infrastructure as far as our family systems and what works and doesn't work. And I know that that's been lost through the assimilation or attempted assimilation process. But what we're trying to do with our tribe is to try to bring back some of those cultural values and implement the use of our families, our uncles, our aunts, and also the mentoring. And I know that it's not anything scientific, but we do know it worked in the past. And we're trying to bring those things back. And so I'm hoping that the department will be able to take those kind of things into consideration and allow us to begin to implement them.
Hello, I'm June Adams from Yakama Nation Aknawisha program. And the one thing that I'd like to bring to your attention is that we wrote our own tribal licensing policy, and we've been negotiating that with the state for over a year now. So we need some kind of like deadlines as far as like this negotiation process, because we're still having trouble recruiting and retaining foster homes, and we wanted to put more culturally sensitive foster homes in our system, but the state is still not moving on it. And it keeps going back and forth at the lawyer level. And there needs to be some kind of, timeline as far as that, because in the meantime, we have 186 children on our caseload, only 12 foster homes. So that's a real, it's a real hardship on the tribes.
Anytime you want to say something, just go ahead. Okay.
My name is Lee Collins. I'm the Director of Social Services at the Osage Nation. You mentioned our program this morning from our implementation project, which is still alive and well without you. Thank you, though. I mean, we're still doing what we set out to start and do through the Children's Bureau, so it was a good thing. I'm glad I got this opportunity to be here and participate in this, but by the same token, I'm thoroughly confused. When I came here, I thought one thing about this new legislation, and now everything's cloudy. There's been a lot of talk about evidence-based practices and these other standards that can be used for services. I know that the eligible services are evidence-based mental health and substance abuse treatment. I know that. And then there's some enhancements for 4B as well. In our practice, and we have child welfare and other things, of course, but since we're here about child welfare, that's what I'm talking about. We don't provide mental health services. We have another department that has licensed, certified practitioners that are using evidence-based practices to treat the folks that we send to them, if they live in our neighborhood, so to speak, if they can access it. The same for parenting, the same for different things that I've heard people talk about. So let's say our stuff qualifies. Let's say we do this. Who gets the money? Who gets this 50% or the FMAP rate? Who gets that? Do we get it to pay them? Do they get it? I mean, how does this work? I'm confused now. I had it in my mind that we were going to do this and we were going to show this and that we would get the money. We would probably have to put the money out up front to pay for these services if they required payment. And then that would be a reimbursement to us for our hard work and dedication and all that we do. But now I'm really confused. So I need someone to explain that to me. What are we after here? Because I'm lost now. Oh, and by the way, I wanted to mention AFCARs for tribes. We don't need to wait 2 years. There's already been several years. They should have been working on this years ago, the states. And now to come in last minute and say, oh my gosh, we need more time. Why? I want to know why. I have not seen this. They say they haven't had the time or the money to be able to track this data. When we got a new BIA report about 3 or 4 years ago with all these elements that they wanted us to start tracking, we immediately put some drop-down lists into our information system. I think our person on site was able to do that for us, and presto, we can now track all of these things as long as, data's only as good as what you put into it, the information you put into it. So I just wanted to say today on record to Commissioner Milner that I'm not in favor of waiting. ICWA compliance, it's our birthday year. ICWA is 40 years old today, or this year. And why do we need to wait any longer for states to be in compliance with ICWA? Time's up. The buzzer buzzed. Let's get down and get with it.
I'll be glad to try. Go ahead. Oh, yeah, sure.
Okay, so the services, you don't have to provide those services directly yourself. What the prevention funding stream is therefore is to allow states and tribes to actually purchase those services. If your other agency, your other department is providing them and they're charging you charging you for those services. Then now, under Family First, if the services qualify and if the person who is receiving the services qualifies as a candidate or their parent or caretaker, then you can get federal reimbursement for 50% of the cost of those services. And you would then use that money to pay for the services, whoever's providing it. It is a cost reimbursement program, which means you're exactly right. You have to put it up front and pay for the services, and then you would, for lack of a better term, bill the federal government for that. And we would just make a claim for it, just like you would do for foster care payment under Title 4E, and then you would get reimbursed at the allowable rate there. So if that, I don't know if that helps you or if that confuses you anymore. Did not come, frankly, to talk about AFCARs, but since you raised it, I'll be happy to say we did put out the notices. One is for the delay, and then the other notice requesting comment was on the substance of the data collection that's out there. Both of those periods for comment have expired. We received a large number of comments. I'm so happy that you did. And we are in the process now of analyzing those, and then we'll come forward with what we're able to do with it. But I do appreciate your concern, and I appreciate you raising it.
I just want to make a couple comments to you while I get the chance. My name is Jerry Milner. I'm with the Navajo Nation, and on the AFCARS note, we submitted our position statement on it. So I'm pretty sure you'll be reading it pretty soon, and that's something that Navajo Nation strongly encourages, is to keep the ICWA regulations in there. But as far as partnerships down the road, the Navajo Nation is really struggling with our regional office in regards to receiving technical assistance, as we should be. And I imagine with the rollout of this new act and going by the PIs and so forth, that communication gap is probably going to get bigger. So my suggestion, my comment is that perhaps that your office up there at DC can maybe organize some sort of meeting with all, not just Navajo, but with all of the tribes, because each regional offices provides different directions to every tribe. So if we can get one standardized message from ACF, that would be greatly appreciated. And I echo on everyone's concerns here with evidence-based practice and taking a look at our cultural models and how we parent traditionally. And that's something that we need to consider, and then hopefully that's something the ACF will look into as well. But on another note, Navajo Nation extends across three states. And in every state, the AFDC rate varies. And that is a huge struggle for us. And I know we haven't gotten into the fiscal components of what this act means in regards to claimability, but it would really, really help us, and I'm pretty sure any other tribes that extend across multiple state jurisdictions. If tribes had the opportunity to set their own AFDC rate as they see fits, that's the biggest struggle that we have, and it's going to be the biggest struggle until that gets resolved.
Los Inchenyavu Inipo Rosa Soto Alvarez, Teac. Good afternoon. My name is Rosa Soto Alvarez, Tribal Council for the Pascoyaqui Tribe, and I would echo what this gentleman said. I'm in a standing meeting every year with tribal leaders to share with you our concerns and our challenges, just to be transparent, just to share each and every one of us our models, our challenges, just to be on the same page, because I mean, you seem really open and willing to help us, and we really want to be able to work closer with you so we can be that voice for our children. And if I can share, I was at one time that child that had no voice in the ICWA, in the system. I'm now a tribal leader because of ICWA. So whatever I need to do to be at that stage to communicate those things on behalf of the children and behalf of our nation, jointly would be very much appreciated. Thank you.
Good afternoon, Commissioner Milner. I'm Tanya Devon Torres with Coaching Pueblo, and also here with the New Mexico Consortium. And so I know one of the things that you brought up in the session that you had earlier was on foster care licensing. And is there going to be consideration for the tribes for their uniqueness? And I think that's an important key factor, because as a consortium, we are in the process of developing a blanket foster care licensing standard for all the tribes to utilize. And what that means is it's going to have to take each of those 23 tribes to go back to their respective tribes, go through the process of getting it approved through our tribal leaders. And so we are working on that. But when they take it back, of course, our leaders are going to have their different questions and what works for the tribes. And so even though we're working as a whole to develop a blanket for us to utilize, with the hopes that the states will also take that into consideration, and we can use foster homes for the states to use, and not only for the states, but also for tribes to share foster homes, there may be uniqueness in that. And so I think that that's very important that you take that into consideration when you're looking at that at each tribe, because like Dave said, we vary. Some of us have, what do you call those, casinos? And some of us, like us, don't. So that's something to consider.
Yeah, thank you for raising that. I want to be clear that when we issue whatever guidance we issue on the model licensing standards, it's going to be probably pretty high level. It's not our intent to get into very, very specific kinds of things that you would probably build into your own individual licensing standards. That's our intent at this point, to, again, take the whole notion of flexibility and apply that to the area of foster home licensing standards as well as other provisions in Family First. There's also a provision in the law that says that if you choose not to use those licensing standards that we put out, then you would explain to us why you are not doing that. But as I read the law, there's not any real repercussions if you don't do it. There is a process there that of accountability, that there would have to be the communication there. But of the many challenges that are out there in Family First that I think tribes are going to be facing, I would not put that in the top 2 or 3 because I think that there will be some flexibility there. But thank you for raising the issue.
I'd like to back up and thank you for meeting with tribes. I'm Marlene Templer from the Confederate Salish and Kootenai tribes, and one of our biggest challenges will be the infrastructure. This is a fantastic opportunity, and we see it as that, but we don't have the infrastructure in building support to actually be able to house the people. We're actually at a place now where we have the educational tribal members that have the education, but we don't have the building structure. I would hope, but I suppose this is too high of a hope, that you are working across the board with the Trump administration and looking at the infrastructure dollars and maybe tying us to those.
Can I hear just a little bit more about, when you're talking about the infrastructure, are you talking about physical buildings?
Yes. Yes, bricks and mortar. There isn't any funding out there for bricks and mortar. We will have additional staff that we will be able to hire under this. Right now, we can't even hire the staff that we could because we don't have the space in the room. Yes.
2-question limit. Second question. In your evidence-based practices, there's a provision. Well, sorry, you know, you feds, man, you're. It's you guys. Sorry. I used to be one of you guys. You talk about trauma-informed, but it's not defined. And I'm very concerned about that because what's trauma-informed in my mind may not be trauma-informed in other people's minds. And I've experienced that in dealing with my adopted son and getting into trauma-informed programs that aren't really trauma-informed. And so I think that needs to be defined. And I go back to Dr. Perry, where trauma-informed, there's different kinds of trauma. There's chronic trauma, there's acute trauma, there's, the spiel. And what we're talking about is chronic developmental trauma. And in order for for trauma-informed to be effective, you have to be able to regulate, reason, or relate and reason, right? Regulate and do those three things. And that's not just for our families, that's for all of us. So you can put a family in a very well-intentioned, trauma-informed setting. And if the staff isn't trauma-informed, and if they can't regulate, relate, and reason, they're going to do harm to that family. So to see the word just trauma-informed was a little disturbing to me because it's not really defined. What are we really, really talking about here? So that's my last question or comment.
Real quickly, thank you, Commissioner, for meeting with the tribes today. My name's Anita Madam with the Confederated Salish and Kootenai Tribes in Northwest Montana. I'm hoping this is one of many with the meeting with the tribes consultation, excuse me, because we hear it, but not always are we always sitting across the table talking to each other. So I'm hoping that the state and the tribes and the department can all come together and visit about this before any real things are done. Because, like I said, you see that, and then we don't get any consultation. It's just already said and done before. So thank you.
I appreciate that. Let me just say that we do have some very formal consultation forums that we engage in on a quarterly basis now at the secretary's level, the Secretary of Health and Human Services level, the STAC, Secretary's Tribal Advisory Council, meets on a quarterly basis. And at least for the last couple of those, I've been able to participate and to get input on Family First. Then at the Administration for Children and Families level, which gets a little bit closer to where we sit, we also have a quarterly consultation there with tribal leaders and representatives. And we're also using that opportunity to get input around the Family First legislation and implementation. I don't want to make promises that I can't keep. We are committed to consultation. We also are under very, very tight time frames, as you might guess, for getting our guidance out, and we are also accountable to Congress for implementing the legislation. So the extent of additional consultation that we are able to engage in has to be tempered somewhat against those deadlines that we have. That doesn't mean that we're not going to do it. We are going to do it. It may or may not be at the level that we would like to see in terms of in-person and the kinds of different in-person meetings that would probably be preferable for many of you as well as for us also. But we are committed to getting that input and to considering it and using it as we go forward.
Hello, my name is Sunshine White here. I'm from the Hilo River Indian community from Phoenix area, Arizona. Love the weather here, by the way. Anyway, I guess that was going to be part of my question, is that, and a comment that our tribe does not consider this meaningful consultation, and that was one of the things we were going to ask is when that was going to happen, because we want to have that meaningful consultation with your department and about this specifically. So when can tribes expect that? Although you mentioned being up against the deadline, we would like to know when we can expect that.
Did you all hear that? This summer was what the commissioner said. No. Understand and respect that.
Very quickly, just a comment that you seem like a very reasonable person. I've heard you have had a long career in child welfare. That makes me feel good to know that. You have many decisions to make, many things to ponder over the next few months. And when you make decisions, I'm just going to ask that you put yourself in people's place, look at things through their eyes, and what would you want then? Look at it from their perspective. Use common sense, loads of common sense. You know, child welfare can work, all this stuff. I've been doing this a lot of years, about to retire. And common sense has been one of my best friends. It has let me do things where I have been, I don't want to say a pioneer, but I've led the way. I've done cutting edge things. And it's just because I used common sense. It wasn't because who was it said we're all brilliant? Miss Echohawk told us that. When you're born, you're brilliant. I'm not brilliant anymore. I might have been born that way, but I'm not anymore. But by using reason, deduction, common sense, and being considerate of these different elements, our cultures, our language, our traditions, things like that, I'm hoping that you will make the best decisions for all of us so that it's going to work. Keep it simple. Don't make it where we have to have another meeting just to know what it means.
Well, I will do my best.
Good afternoon. We had 2-question limit, right? So earlier it was a comment. Oh, okay, good.
Get as many as you want.
Well, thank you. Okay, so this is also reflecting back to the earlier session. And in that, you said there's potential for tribes who do not receive Title IV-E to tap into the preventative services. What is that potential, and what does that look like?
That would be through your state tribal agreements, 4E agreements, to be able to access the money. Those are the two vehicles. The two vehicles would be either an agreement with the state or you become eligible to receive direct Title IV-E funding. What about the 4E enhancements? If you're a 4B tribe, you would still be able to get that, but the prevention services funding comes from Title IV-E.
I know, but I read something. I'll find it.
Hello, my name is Tracy Perez. I'm from the Confederated Salish and Kootenai tribes as well. Along that same line, we have an approved plan, but we haven't implemented the 4E Direct as of yet. So it seems to me, after hearing everything today, that this fourth component of 4E would be a good starting place for us, given that we don't have to have a cost allocation methodology and the eligibility determination piece of it. So am I correct in understanding that we could start with Families First as our first stage of implementation, and then move towards the other components where we would be receiving reimbursement in the administrative and training and maintenance later?
That's going to be a little too technical for me. I'm sorry, I don't want to give you an answer that's not correct. I don't know. I'm sorry, but let me look at that and see. And tell me where you are again?
Salish and Kootenai in Montana.
I'm Julia Hinsey from Salt River. We're also from Arizona, so we agree with Gila River. The weather's beautiful. I just had a couple comments on evidence-based practices for tribes. Salt River has an extensive array of service area that we can use evidence-based practice stateside, but we've developed our own internal system and our own practices because we've realized although the state has evidence-based practices, they do not work in Salt River because they are not specific to the community. So when we developed what we call circles of support, that's part of our behavioral health team now, we went and actually asked constituents, all of our clients, what would work for you? When I'm looking at evidence-based practice, there's a length of time, there's the population, then being able to apply that to some other study, people who have never been part of the service. I would like for you guys to think about, for tribes, squishing that down because our population base is way smaller than any state's ever going to have. The amount of families and recidivism rates, our numbers are going to be a lot smaller. So then our statistics may not be as great or be able to show you the p-value changes that you would like to see that you would get from states. So that would be one of those things that I would like you guys to consider. And then also, what kind of other populations would the tribe be able to measure against for those that have no service area and those that do, because we are using the same population. I don't know if that would qualify under your statistical analysis for behavior evidence-based practices.
So thank you. And once again, to the extent that we have flexibility, we want to use it. I just want to be real clear about that. The law is quite prescriptive, and we didn't write it. And it lays out the criteria at those higher levels around the randomized control groups, and that we don't have the ability to change. But there are places in the law that allow us to exercise flexibility with the tribes, and if it does exist there, absolutely, we want to. We would have no reason not to want to do that, to make more services accessible to the tribes. I also want to repeat, probably for maybe about the 10th time here, that we do have that Federal Register notice out on the street right now. The deadline is July 22nd. For those kinds of real legitimate concerns that you're raising about the evidence-based practice, the criteria, the kinds of things you'd like to see included there, particularly around cultural adaptation of services to meet your needs, please give us those comments. It would be quite helpful to us.
Good afternoon. I'm just a little curious about something. The new law requires a lot of partnerships to be developed by tribes in order to be successful. I'm just kind of wondering, what kind of interrelationships have you created with BIA, IHS, and other federal agencies so that they have a buy-in, like you're requesting the tribes to buy into this? I'm just wondering what you've done at that level.
Well, you mentioned two that we need to form those kinds of partnerships with. There are others as well. The whole behavioral mental health component of the federal government, SAMHSA, the Medicaid area is one where we need to make those strong relationships. The HRSA, where we've got the healthcare resources services out there. Centers for Disease Control have a lot of applicability for the work that we're doing, education, housing. The list does go on. And I think we have begun the process of our own collaboration with them to try to find the points of intersection where the services, the funding, the requirements that are applicable in some of those organizations would interface with the ones that we're dealing with here. That's going to be a long process. It's not going to be where we have a meeting and say we got it all worked out. I think we have to go through an exploration phase where we try to identify how we're going to mutually support each other in implementing something along these lines that will actually lead to the kind of results that we're looking at. So, I mean, what I can say is we totally recognize with you that we need to have those in place. We have begun that process, but we are nowhere near as far along as we need to be and as we will be as we continue through this implementation process.
Oh, yeah, I'm sorry, I'm looking at my note. Sorry, I'm awake. Thank you. I was just reading my note over again. Thank you, Commissioner Milner. Francine A. Jones with Clinton High Central Council. The question I have is, again, about 100 of us as tribes have tribal state agreements, and part of our challenge will be to get buy-in or entice our state partner that this is a good thing to move forward with. And the question I have is, I know when we were looking at Alaska for the 4E maintenance, what was enticing is we could negotiate the FMAP. So it was a good win-win for the state to enter into that agreement because the FMAP for the tribe was higher than the states. I would hope that to entice those states to have those partnerships with those of us that don't have direct 4E, if the federal government would consider accepting the FMAP of the tribes at it would be a higher rate, so there would be a win-win. So I just offer that as a comment.
Sure.
Tribes don't have a lot of resources or income coming in. We don't get a tax base, and casinos may or may not be a revenue source for us. It would, I don't know how flexible you are with the federal match with federal dollars, but if we could use IHS funding, which on most tribes is less than 50% of need anyway, and if we could use them as match, I could use 2 of their workers and turn them into 4 workers at our 50%, and then we're serving the community much larger. So if you look at IHS at least as a federal match.
And I would just mention, if I can, just that 638 funding, when tribes contract with IHS, is considered non-federal funding. So we'll just throw that out. Okay. Anybody else?
I have another comment. It's not related to Families First, but I have a question regarding your opinion and the climate of Congress as far as refunding capacity building for tribes, because we utilize their service and we find it very, very valuable. Just recently, we were able to meet with capacity building for states and our state representatives, and we have identified on both sides areas of improvement. And I do know that that's tied in with capacity building for court improvement programs. So I think that that's really a great need for tribes. We just accessed them last year, and I know that they're getting ready to start winding down with our tribe, and I really want to advocate for that program to continue because it's done wonders for our program, and I'm from the Hopi tribe.
Funding cycle of the 3 capacity building centers. Our intent is that we will fund an ongoing technical assistance effort there. We have not reached the point in our planning yet where we've talked about any kind of revisions or changes to it, but the ability to support tribes through technical assistance will remain beyond the current funding cycle.
Anybody around the outside? If the folks on the inside have tapped themselves out? Anybody around the outside of the room want to ask a question? Or okay, well, the inside of the room's allowed to ask too.
I would
Just wondering if you guys had any, well, first, thank you for being here. Secondly, I wondered if you had any comments from any opposition to this. I mean, it sounds great, but there is an existing anti-ICWA movement, I will say, and those that wish to promote adoption in the adoption agencies. And so just wondering if you guys happen to have any opposition openly, and how do you intend to address that?
So to understand your question, are you asking if groups are coming in to us to oppose ICWA? Not in any formal way that I'm aware of, and we're supportive of ICWA. So I am conscious of the fact that there are sentiments out there that are not supportive of ICWA, but at least in the few months that I've been in the job, nobody has come into me to voice their complaints about ICWA.
The back of the room is ready to speak.
Hi, I'm Holly Echohawk, and thank you so much again, as I told you before. But I know the evidence-based practices is a concern in the room and a concern nationally across Indian country. But you said that there was a little bit more leeway in the promising practice section of the 3. So can you speak a little bit more on why there's a little bit more window there when they each have the same statistical requirements or reference? So anyway, let me hear a little bit more about.
You're going to get your exercise today, aren't you? All right, running back and forth. The promising, of course, is the lowest level of evidence that would be required. That in and of itself gives us some flexibility. At the well-supported level, the statute requires, I believe, at least 2 randomized control tests, which can be very expensive, and as somebody over here has pointed out, very difficult in terms of getting the control groups and all of those things in place. Even at the middle rung, at the supported, there's got to be at least 1 randomized control group study there. At the promising level, there is a level of evidence required. It's just not as rigorous, and that's why it's called promising rather than supported or well-supported. So we've got the ability there perhaps to get some services at the promising level that have not undergone that higher level of rigor in terms of the testing. There was something else that, okay, so, but the reality is this: the law does require that 50% of the funds claimed under the prevention services funding track be at the well-supported level. So unless we can find the flexibility there in the statute, there's going to have to be a balance between the higher levels and the lower level of evidence-supported practices in order to claim the money there. But at least we think if we can get some of those interventions in that have not undergone all of that high level, that we can use that opportunity to begin to build that evidence at the higher levels. Yeah.
Thanks for the less rigorous is good, but my other comment, I guess, is, and this is a concern that I've heard from many tribes across the country, is rigor implies hierarchy. Less rigorous from tribal perspective does not mean less effective. So that's the kind of the challenge in having promising, supported, well supported. It implies a hierarchy, and that gets back to leveling the playing field of who's the expert. And it gets back to youth-driven, youth voice, family voice, strength-based, all of that. So there's a real challenge in trying to navigate that in a way that doesn't imply, less rigor does not imply less effective.
So I think we have about 1 minute left. So is there one last parting comment, question, thought? Anita, do you want to take the last?
I, on the side, did, but my colleagues here wanted me to publicly extend a formal invite to you to come visit the great state of Alaska. And I think it would be an opportune time to one, because of the great work we've been doing with the state of Alaska around really transforming Alaska's child welfare system. So this is really in line with the work we've been doing, and I think it would just be awesome for you to meet and see the other tribal partners in the work that we're doing. And again, like we said in the other listening session, those tribes that have great relationships with states and we're really trying to do some innovative work, and we've really worked hard for many, many years to develop those relationships. It would just be really wonderful to see the feds to embrace that work and really allow those states that have those relationships with tribes to support the work that's going on and really align the work so we can implement. So again, if you could look at your calendar, we'd love to have you come visit us. Thank you.
And I'm Mary Johnson, and I am with Tanana Chiefs Conference in Alaska also, and appreciate Francine extending the invite. I think that we have done some amazing work in Alaska with along the lines of tribally licensed foster homes with our compacting, and we've done it with no extra resources, with just the commitment, shifting gears a little bit, looking at things differently, working with our federal partners and our state partners, that there's just amazing work going on right now. It's exciting. After doing the work for so long, we hear opportunities like this and we're like, oh, another big project. But there's, hearing what other people are doing and how they push past it, and if there's ideas that anyone can bring to the table to learn, because that's what it took us, and we've created a model of working together with the states and our federal partners to get things moving. And I think it'd be great if you were able to come up and see that.
Oh, I see one. I'm gonna squeeze one more minute out. One more question.
Well, it's more of a thank you. I want to thank each and every one of you guys for being here. The work that you do is really important. It does matter. ICWA matters. And I just want to thank each and every one of you for being here, and Casey and NICWA. I just appreciate all you guys' work, because I hold, I'm sorry, I didn't mean to get emotional, but all those kids in the foster care system, I just thank each and every one of you for the work that you guys do. Thank you.
Thank you very much. Thank all of you. This is, as I said this morning, David and I came here to listen, not to talk at you, but to hear your concerns, and to continue what is certainly for me a learning cycle around things that matter in the Native American community and within the tribes. Every time I have an opportunity to visit or to have those conversations, I learn a little bit more, and it's invaluable to me. So I appreciate you sharing that with us, and I think I'm going to ask David to kind of finish it up here for us.
This is just to prove that I know how to talk, I think. I also just wanted to say thank you to everyone and say what an honor it is to be with you. I also just want to share a parting thought or two, and the focus of this meeting has obviously been on family first. And Family First is an incredible opportunity and an important tool. But we have a grander vision for child welfare in the United States, and it's to turn child welfare into a system that's about healing and wellness. And these are principles that you know better than we do, and that states are still really struggling with. And we don't want to lose sight of that grander vision, and it's a vision that would make foster care an option of last resort, and would make strengthening families the first and most important priority, so that families stay together in the first place. And that in this kind of healing and wellness vision that we have, the focus would be on preventing any kind of maltreatment from happening in the first place. And Family First can help us move down that road, but it's an initial step. And there was a woman who spoke earlier today who I think quite rightfully said that Family First isn't going to solve everything. It won't, but it can help us down the road in the right way. And all these requirements of law present challenges that we're going to work as hard as we possibly can to overcome and interpret it in the ways that are most helpful. But we really do appreciate the challenges around these evidence-based practice requirements for work in Indian country and with tribal children and families. And there are supports and ways of helping families that may not ever lend themselves well to an RCT, and we don't want those to be lost or undervalued or go unappreciated. So.
Well, thank you for this audience. And any last remarks? Okay, well, thank you everybody here for coming and participating so actively. Give yourselves a hand.